All right, I am going to be doing a newborn assessment. Prior to doing the assessment, I am going to perform hand hygiene. I'm going to provide privacy. I'm going to introduce myself to the parents, and I'm going to ask permission to perform an assessment on their newborn. Um, I'm going to review the chart. I'm going to look over the pregnancy, all the prenatal history, the delivery history. I'm going to review the APGAR scores, um, and any other pertinent delivery information, whether the baby had any trauma at birth, whether it was a C-section or vaginal delivery, etc. So the first thing that I'm going to do as far as my assessment after I've performed hand hygiene, I'm going to do a general survey of the baby. And in my general survey, I'm going to be looking the skin over generally. I'm going to note some of the common skin findings that can be found on a newborn. So one thing that can be found is the presence of vernix, which is going to be a thick white substance. That is a normal finding that can collect in the skin folds, the ears, etc. Another thing can be lanugo, which is a fine kind of downy hair that can be present on babies in their upper arms, their back, their ears, sometimes a little on their face, etc. And I'm going to look for the presence of milia, which is going to be found across the bridge of the nose generally and on the face, and those are little small white bumps that are like calcium deposits. So another thing that I'm going to be assessing for skin-wise is going to be in the mouth, and that can be something called Epstein pearls. Those are also calcium deposits, and they're going to be a normal finding. If those are noted, I am going to check for any presence of petechia on the face. That could be noted through the birth. I'm going to look for something called erythema toxicum, which is a red kind of blotchy spotty rash that is a normal finding on newborns as they're adjusting to the exterior environment. I'm going to also check for birthmarks and for the presence of Mongolian spots. I'm going to document those if those are noted, because those can resemble bruising, and those are important to note for documentation purposes, so there's no, if there's a concern of abuse or something like that, that has been previously documented. As far as for the assessment, I'm going to try to move in a head-to-toe fashion the best that I can. I am going to inspect the baby's scalp. I'm going to look for any caput, which is just some, something that can happen during during the delivery. I'm going to see if there's a presence of acephalohematoma, which can be noted if there is a vacuum delivery or use of forceps or any type of excessive trauma. I'm going to check for both of the fontanelles. I'm going to view the anterior fontanelle and the posterior fontanelle on this newborn. I'm going to not assess that if the baby is crying, because that can give some false information. It can appear to be bulging, which is not going to give accurate information. So I want to, the anterior fontanelle is going to be more of a diamond shape. The posterior fontanelle is going to be more triangular. I don't want them to be bulging or sunken in. I am going to assess the baby's eyes. I'm going to look at the, the conjunctiva to make sure there's no evidence of conjunctivitis. I'm going to note that the iris is generally going to be like a slate gray in most babies to begin with. I am going to check the pupils I'm going to ensure that the pupils are equal, round, and reactive to light. Babies generally do not have, their eyes do not accommodate well at first, because they have been in a dark environment essentially, and they've not really had much to focus on. Also going to note that strabismus is a common and a normal finding in newborns as well. I am going to note the symmetry in the way the facial features are positioned. I'm going to note that the outer canthus of the eye should be in line with the ear. If there is a variation from that, I'm going to document that. That can be associated with some genetic issues. I am going to, as far as the ears, I'm going to inspect the ears. I'm going to make sure that they are well formed. I'm going to make sure that there are no ear tags or deformities in the exterior ear, because those can be associated with kidney dysfunction or some type of kidney issue that the pediatrician will need to follow up on. As far as the baby's nose, I'm going to check both nares for patency, because babies are nose breathers. And as far as the baby's mouth is concerned, I'm going to inspect the mouth, and with a gloved finger, I'm going to check inside the mouth. I'm going to be feeling for any type. I'm going to make sure that the palate, the soft palate and the hard palate, feel intact. If it is not, I'm definitely going to document that. So that can be evaluated promptly, because that can put the baby at risk for feeding difficulties and put them at risk for aspiration. So while I'm already dealing with the mouth, I'm going to check the baby's suck reflex with a gloved finger. I can also test the rooting reflex by touching the baby's cheek or the chin and ensuring that the baby turns to my finger and as if it's trying to find a nipple, because this is an innate instinct that newborns are born with that should be definitely present. I'm going to inspect the neck, and I am going to inspect the clavicle. I'm going to ensure that it is intact and does not have any indication of fracture, which can occur during birth as well. I am going to move down and inspect, as part of my inspection or general survey, I'm going to inspect the nipples. If they're, I'm going to note that breast buds are a common finding in both male and female newborns. And if, but I'm going to document that if I find that. I am going to note the placement of the nipples and ensure that they look to be appropriately spaced, etc., and there are no extra nipples or anything of that sort. And I am going to inspect the baby's abdomen as well. I'm going to inspect the umbilicus, and if this is a freshly born baby, I would be able to visualize that there's 2 arteries and 1 vein in the umbilical cord stump. But I am, if it's already dried, essentially I want to just look at it, make sure there are no signs or symptoms of infection, that there is no drainage, oozing, discharge, odor, anything like that. If there is, I'm definitely going to document that and report that to the physician. So as far as my looking, okay, then I'm also going to inspect the baby's genitalia. If this is a female baby, I am going to ensure that it looks like there's enough labial skin and fat to close over, to conceal that the labia majora can kind of conceal the labia minora and the clitoris. I'm going to note if there's any presence of vaginal discharge for a female newborn, which can be a normal finding as well. If this were a baby boy, I would inspect his penis to make sure that the urinary meatus is centrally placed at the tip of the penis, and does not appear to be low set or high. Low set meatus would indicate hypospadias. If it were up high, it could be epispadias. I am not going to attempt to retract any foreskin. I'm just going to visualize it externally. I'm going to check the scrotum for rugae, and I'm going to ensure that the testicles do appear to have descended into the scrotal sac. I am going to also check for, while I'm in this region here, I'm going to check for anal patency with a gloved finger. I'm just going to press against the anus and see if there's an anal wink, indicating that those anal muscles are operating. Also, while I'm down in this region, I am going to check the baby's hips for hip clicks or pops, anything that could indicate there may be some dislocation taking place. So as far as my physical assessment of the baby, I'm going to listen to the baby's heart sounds. I'm going to take an apical pulse for 1 full minute. I'm going to listen to the breath sounds, and I'm going to note that it's a normal finding if there are wet breath sounds within the first 24 hours. If the baby's had its first feeding, I am going to note that there should be positive bowel sounds on that assessment. As part of my interview with the parents, I'm going to inquire about whether the baby has been having wet diapers, how the baby's feeding, and if the baby is past meconium and things like that. As far also as the assessment, so for the normal, so you would measure the baby's length. And the baby's length, the baby's weight, you would measure the head circumference and the chest circumference, because those are going to be followed throughout the well baby visits, so you can check for growth. Let's see. So I am also going to check the muscle tone. I want to make sure that all the extremities move well bilaterally and equally. I'm going to ensure that there are 10 fingers and 10 toes as well. I am going to ensure that the feet do not appear to have any clubbing going on. I am going to also, so I think I've covered the anterior portion of this little cute tiny baby, my little preemie friend here. I'm going to turn the baby over, and I'm going to inspect the back of the baby. I'm going to check for the placement of the vertebral column. I'm going to be looking for any openings at the base of the spine or any sacral dimpling or anything like that. I'm definitely going to report those findings if those are noted. I'm going to put this baby back over this way, and I am going to talk about the baby's reflexes. I have already talked about the suck and rooting reflex. I'm going to check for the Moro reflex or the startle reflex by just kind of lifting the baby up and appearing as if I'm going to let the baby fall back, which I would not. But the baby should exhibit a startle reflex by the arms going out. I can check for the tonic neck reflex, where the baby would turn its head and its arm, this guy does not like to move very well. The arm would go out to that side. I'm going to check those bilaterally. I am going to check for the palmar grip reflex, where the baby should grasp my finger when the palms are touched. The same thing should happen when I touch the toes. The feet, the toes should curl against my finger. I'm going to check the Babinski reflex by stroking the bottom of the foot, and the toes should splay out. That is a normal reflex that should be present in newborns. The suck reflex, the swallow, the palmar, the plantar, the startle, the tonic neck, the stepping reflex in a baby is where you would step, put the baby on one foot and they're going to lift one foot, and it kind of in the appearance of stepping. That's also a normal reflex in the baby, in a newborn. I think I've covered the reflexes. I'm just going to note the state of the baby. So this baby here is just kind of in a quiet resting stage. I think that's it. Thank you.